So my name is Mimi Meredith, and I am proud to be associated with LMH Health, and so glad to see you all here tonight. It's a great showing of our community. It's been fun to see so many people run into old friends here. So I'd say we should do this more often, but it will be under different circumstances. We have a great panel this evening and some other experts here to help you as well, including our own wonderful CFO, Rob Chestnut, and I'll introduce him to open us up with some welcoming remarks.
Thanks, Mimi. I hope we're able to get together under different circumstances, but thank you for coming. This has been a big transition for us. I think one of the things first saying this is an incredibly confusing topic for everyone, not only providers, but obviously for all of our patients and especially for Aetna and Humana Medicare Advantage patients, and we know that we've now contributed to that confusion. So our goal here is to basically figure out how to transition your care so that you can continue to be LMH Health patients. And I think that what you'll find is that for as many Medicare Advantage members there are out there, there are that many plans. And that is really how confusing it is, because the permutations on just Aetna and Humana are in the dozens. You know, whether you've attained it from a retirement through your former employer or signed up, as you know, there are a number of plans out there. So again, you know, I think that we know that open enrollment comes up on October 15th. One of the things that's really important to remember is we're here to try to help this transition as much as we can. The brochures that we passed out, and I'm sure there'll be a number at sometime we'll display that. But one of the things is we do have what I would say is a Medicare Advantage hotline that we have. What we've done is, do I need to advance this? Okay. What we've done is really, Mary Goodlett is becoming our expert on this. We've now fielded over 650 calls with just different individual talking about what's your plan, what is your out of network benefit. In some cases, that is a good alternative. So there's a lot of things to think about here. And again, you know, this was a difficult decision for us to make because we recognize how much transition it's created for people. But regardless of that, I think one of the things is we've gathered a group of panelists here to talk about this. And I think this is just a start for us, which is how do we get as much education out there as possible. There'll be other opportunities to interface with other brokers in town that can help navigate that, because it is an individual decision and an individual evaluation. Out of the number of folks that we have, which is roughly around 4,000 that are affected in some way or fashion, there are 4,000 different scenarios. And that's really what makes this super challenging. So again, thank you all for coming. And obviously this is a very, very important topic for us. And I'll turn it back over to Mimi to introduce our panelists.
Thank you so much. Thank you, Rob. So there's Mary's number, and take a shot with your phone or write that number down. We're going to introduce the panelists. Shannon, if you want to pick up the mic and hit the red button on the bottom.
Red button on the bottom.
And then do you want to test it to see if it's on?
Hello.
Oh, yeah.
There. So Shannon, we're going to start with you. If you want to just introduce yourself and tell us a little bit about you, that'll be great.
Okay. My name is Shannon Flock. I work for the Kansas Hospital Association. I spent before that about 15 years in hospitals. I have a finance background, but really what the Hospital Association does is, as far as Medicare goes, is we have the direct contact with CMS, Medicare, and our Kansas congressman in DC, where we're trying to help them set policies and understand and what the regulations need to be around the Medicare and Medicare Advantage program. So on top of that, we try to educate our community and our congressman about the struggles that Medicare, Medicare Advantage make for our hospitals. And I'll explain a little bit about that when we talk about knowing your facts around your choice of Medicare versus Medicare Advantage. And we'll talk more about that here in a second.
Hi, I'm Mary Lawson. I am the billing supervisor for Medicare, also for follow-up. And I've been here for about 20 years, not fully in the Medicare business, but I've been here 20 years and have a great group of staff that is working diligently with you, to try to get information out to you guys regarding this.
Hello, everyone. My name is Pat Brown. I'm actually a local financial advisor here in town, and I have an expertise in Medicare planning. I've been doing that for about 10 years. Got into it because my mom was going through the process, and I just became so angry with all the information that was out there. So that's what kind of got me involved and just really trying to understand as much as I possibly can. I'm also on the board as a trustee.
Hi, I'm Lori Phillips. I work for the Senior Resource Center. I'm the Health Resources Coordinator there, and I'm also in charge of the Senior Health Insurance Counselors for Kansas program for Douglas County. I recognize some people here who have used us or at least come to the Senior Resource Center. If you don't know us, you need to know us because we can help you with your insurance free of charge. We don't get any commission. We don't get any kickback. We are underpaid, but we can help you get what's best for you. And I'll talk to you more.
Hi, my name is Sherry Magaquick. I'm a physician here at LMH. I've been in practice here at LMH for 21 years, and I was in Topeka for 3 years prior to that. I also serve on the board of trustees with Pat. So I'm here to let you know how Medicare Advantage plans have affected my patients in both our clinic setting. I have a partner that does outpatient work, and then in the hospital setting.
Thank you so much to our panelists. So we're going to pass the mic back down to Shannon. We'll start with Shannon, who's going to give us an overview from the Kansas Hospital Association, and then I'm going to ask the initial questions of our panelists. And this is Cindy, who's going to run the show for her. Nice. And if those questions don't cover what you want to know, then we'll have open time for questions and answers, and that will include our friends who are listening and watching from the overflow rooms. We'll have runners to bring your questions into our panelists as well. So let's get started with Shannon.
Thank you. So I think we're going to spend about 10 minutes here just going through the basics of Medicare. Let's do that first. Let's set the stage, and that'll help you with asking questions and, what is your concern right now? So real quick, the difference between what we call original Medicare and Medicare Advantage. Original Medicare is your Part A and Part B. And most of the time, most people will have a Part D part of that, which is the prescription drug, and then may also have a Medigap plan, which is a supplemental plan that supplements some of those co-pays, deductibles that you have in Part A and Part B. You will, to have the all-inclusive, you're going to have all 4 parts. Medicare Advantage is a private insurance. It's not the federal program. It's a private insurance that the federal government is paying, such as United Healthcare or an Aetna or any of those others to run on their behalf. But because of that, they are a private insurance. They are able to set a lot of times their own policies and regulations around the care. Okay, so that's called Part C. That is going to replace your A, B, and D. And a lot of times your Medigap plan as well. So if you sign up for a Part C, and this sometimes is mistaken, people don't understand this, you're giving up your A and B. You're giving up your federal government program, and you're signing up with a private insurance company. So that is just a definition. Moving on. So again, we're talking a little bit more, and will they get these slides or not? Okay. So I won't go into much detail, but this is just giving you some, again, explanation about the A, B, C, D, and the Medigap. But the one thing I want to make sure you understand, you sign up for Part C, you have just given up A, B, and D, okay? So, just a quick question, go on to the next slide. So Part C, again, this is a Medicare approved plan from a private insurance company that offers an alternative to original Medicare. The plans vary, and I'm sure, you know, you're getting those phone calls, you're getting those mailers. One thing as to why the federal government put in Part C is they thought that there are some gaps in original Medicare. A lot of times it doesn't pay for eye care, it doesn't pay for dental care. And so they thought, well, maybe if we turn it over to private insurance, they can start adding those, but at a reduced cost. And sometimes you gotta remember that. They're doing it at a reduced cost. So we'll talk a little bit more about knowing your facts about what you're getting if you're signing up for a Part C plan. So moving on, so go ahead. So what are the 5 main differences? And this is where, again, we just want to make you aware. It is your choice what you sign up for. You know, we at KHA is not going to say, don't sign up for this or don't sign up for it. It is your choice, but know your facts. If you sign up, the 5 main differences: 1, going to the doctor. One thing you should know. Original Medicare contracts with 99% of the physicians. In other words, you probably are going to be able to go to anybody you want, physician-wise. Not going to have a problem. Medicare Advantage has narrow networks. They do this, again, because they're trying to direct you to certain people, certain providers. And because of that, it doesn't mean you're always going to have a choice between every physician. They are going to pick, most of the time, the cardiologist you're going to go to, the cancer doctor you're going to. So again, know your facts, still your choice. Number 2, covered care. Original Medicare, it is pretty straightforward what they're going to cover and what they're not. You know, there's a few things that are going to be out of network, like I said. They don't do dental, they don't do vision, they don't do hearing. You may get that with Medicare Advantage. But what we've seen with Medicare Advantage on those extras is you gotta have approval from them to go see it. Doesn't always mean that they're able to set their own policies and regulations. So even though they advertise that you get dental, you get eye, your dentist is going to have to approve for that care. It's going to have to approve to the insurance company, and the insurance company says, okay, you know, we'll let them come get their cavity filled, for example. Okay, so again, something to know. Next word is network. Well, actually, we've already talked about this, is that most of the time, they're based on limited networks. So a lot of times you may have to travel longer distance to find that specialist that's in network. Costs. I know they advertise a lot about free. Sometimes you get what you pay for. And sometimes it's going to be a surprise. We've seen lots of examples where either you're going out of network or you're in the hospital and those undisclosed things are going to cost you. And there's a lot of facts out there that show there's been lots of examples where you've actually paid more out of pocket, even though it's considered free. Okay, so completely your choice, just know what you're getting into. Read the detail in those contracts. Know what it says. Know what has to be authorized before you are approved for it. There's lots of denials going on in hospitals, and I'm sure they're going to talk about that a lot, where the patient needed an MRI And they've, again, had to have it approved for Medicare Advantage, where with original Medicare, they don't have those prior auth regulations like they may in a Medicare Advantage plan. So, and then lastly, again, we just talked about approvals and authorizations. Most services with original Medicare do not require prior authorization, an approval from Medicare. Doesn't mean that there aren't a few. There are a few that, yes, the doctor has to have approved. Medicare Advantage, most all plans have a list of everything that has to be authorized. And it gets overwhelming for the physicians and hospitals constantly on the phone trying to fight for those patients to get approval to have those services done. And they can tell more of the stories, but there's been lots of stories about patients that needed services and they're not getting them sometimes with Medicare Advantage because they can't get it authorized and approved. So know what you're getting into. That's all we're gonna really say. Know what you're getting into, read the fine facts. There are some difficulties that hospitals are seeing more with Medicare Advantage versus original Medicare, and it comes back to caring for the patient. And again, to support a little bit about what LMH is, I know they made some tough decisions here, but just keep in mind they're making them because they feel the patients are not being taken care of right. And that's concerning them. So with that, what else do I got? You know, I can go in through a little bit of the statistics that were shown. 99% of Medicare Advantage plans have prior approvals. I apologize. I did not bring my glasses and I can't read through them all. But you can read through all of those. There are clear statistics out there showing the concern that LMH has right now with Medicare Advantage. That's making it difficult and they're seeing their patients being harmed.
I'm
So,
gonna read those, Shannon.
go for it.
Because I'm not sure that the other rooms can see the
Thank
screen
you,
as
go for it.
clearly. So the statistics are 99% of Medicare Advantage plans require approvals and authorizations before care can be given. 53% of the time, physician judgment is overruled by the Medicare Advantage plan. Dr. Quick, I know you can speak to that. 94% of physicians polled said authorizations delayed medical care. I'm going to read that one again. 94% of physicians polled said those authorizations delayed medical care. Roughly 1 in 5 who left their Medicare Advantage plan in 2021 cited problems getting the plan to cover medical services, and 3.4 million Medicare Advantage requested authorizations were denied in 2022. Shannon, I want to thank you and Cindy so much for driving over to be with us this evening. We value the Kansas Hospital Association and everything you do for our state and to advocate for hospitals, but mostly for the people of Kansas who deserve great health care. So thank you. Oh, did I?
No, that's okay.
Okay.
Again,
Yes.
more information they will get on some Know Your Facts infographics that they will be telling out about. Again, those questions you need to be asking if you're thinking about signing up for Medicare Advantage. There are certain questions you need to be asking the insurance company. You need to be asking your physician.
Yes.
Their thoughts. And so.
And we have that, and we repurposed your flyer on all of that. And if you did not get a flyer tonight, we will attach that to an email. If you email us, we will email that flyer back to you so that you have all those questions at your disposal.
Perfect.
Thank you again
Thank you.
so much. So on to one of the Marys who might be able to answer your questions. I don't know if at LMH Health, we decided everyone who takes Medicare questions has to be named Mary, but it is a coincidence for sure. So Mary, when you're fielding those calls, what are some of the top questions and concerns that you think folks here might share tonight?
Well, I haven't been taking the calls. Mary Goodlett has, so I appreciate that, Mary. I'm on the billing side. So what our top concerns at LMH is seeing are authorizations and denials. Traditional Medicare versus Medicare Advantage. Traditional Medicare has only 55 services that require authorization, and only 4 of those are medications. Now, Medicare Advantage has a significant amount of services that require authorizations, including numerous medications, and I'm talking oncology medications, the expensive medications. These are situations where we obtain an authorization and bill appropriately. However, when Medicare Advantage plans review, they want to do a level of care revision, causing a lower reimbursement rate. Our billing department has been overwhelmed with the volume of claims that require follow-up due to payments, delays, and disputes. And with the increase in denials, this has led to an increased staffing need just to manage these issues. Unfortunately, the time and resources spent on these challenges detract from our ability to focus on patient care and support. Those would be the two top ones, is just those denials. And I'm not just talking about inpatient denials. I'm talking about, MRIs. We may have to tell a patient they have to come back because we couldn't get that authorization.
Thank you so much, Mary. Thanks for all that you do. And I know that, Pat, you mentioned that you were initially not thrilled with what your parents were finding out when they were going through this maze. And so that led you to this calling to dig in and find out more. I want to ask, how many of you are Humana or Aetna customers here tonight who had okay. So my guess is you all are here to find help finding something that could be comparable. So Pat, could you tell these folks what are some guidance you would give them for things that they should look for?
Well, I think ultimately you want to, side by side, see what you currently have, see what the coverages are, see what the costs are. With the Medicare Advantage plans, they're essentially a la carte. So basically it's going to be a cost for everything as you kind of go down the line. One thing I will say kind of up front, definitely look at either finding an agent or a broker to kind of help you through this process, or use this resource here. Well, the only reason I mention it, as far as a broker, someone that will actually educate you through this whole process. There are some people, just like any service industry, that are going to be kind of unscrupulous. And I'll tell you, as an agent, agents do get compensated more on these Medicare Advantage plans. And so a lot of the commercials, a lot of agents may push these plans versus educating you on a supplement plan and the benefits of a supplement over Medicare Advantage. So I would advocate for that, just to find someone that will really sit down with you and literally go side by side. Okay, with Aetna, Humana, it costs this much for, to go to the hospital. It costs this much for, to see your doctor, et cetera, et cetera. But I would definitely say, look at the cost comparison and kind of make a decision from that point. There's so much I can get into with the Medicare Advantage. I don't know if we have that much time. But so that's what I would say, just to kind of do a side-by-side comparison.
Okay, thank you so much. And Lori, I can just tell you are so eager. So
I'm sorry, I'm gonna take this over, I'm afraid.
That's all right. We are so grateful to have the Senior Resource Center in our community. And I just wanted to say, there might be some advantages that are available through Medicare without Medicare Advantage that many folks here aren't familiar with, because maybe Medicare doesn't have Joe Namath as a spokesperson, just a thought. So could you speak to some of that for us?
Well, sure, Joe Namath got paid big time for that. And all of those people do for those commercials. I work at the Senior Resource Center. We see people and explain Medicare on a daily basis, how it works, and why there are certain ways to go that might be best for you. You make the decision, but as I suspected, most of you are in Medicare Advantage plans now. And there's a little bit of panic about it. We have open enrollment between October 15th and December 7th for drug plans and Medicare Advantage plans. And we also have Medicare Advantage open enrollment between January 1st and March 31st. You would call us, you'd leave your information.
Mary, I'm so sorry. I just want to do a quick fact check, because for the folks here that have Humana and Aetna, if they waited until January.
No, they don't have to.
Right, we just don't want anybody to think, oh, wait, I have Medicare Advantage, I'll wait until January because their coverage wouldn't be accepted at
Thank you.
LMH Health.
That's right. That's right. So what would be best for those people who do have Humana and Aetna is to go ahead and make an appointment for open enrollment at the Senior Resource Center. We don't charge you anything. We don't get any money for it. Brokers sometimes get up to $600 per person for signing you up for a Medicare Advantage plan. So they have a reason to do that. We can help you find a different Medicare Advantage plan free of charge from us, or we can maybe possibly help you go back to original Medicare. And you might think, well, I didn't want original Medicare to begin with. Well, original Medicare you can take anywhere in the country, and if you have a supplement, it will follow you where you go. Sometimes it's a little tricky getting a supplement after you've had Medicare Advantage for a while, but if you're leaving an employer insurance, if you're leaving retiree insurance, you can have a guaranteed issue right to get a supplement plan within 60 days of ending that insurance. And usually, going back on original Medicare, you're already paying for Part B. It's already coming out of your Social Security. And then getting a supplement plan and a drug plan. Usually that is cheaper and covers much more than a Medicare Advantage plan. You might have to get a separate vision plan or dental plan. But if you have a dental plan now, you can sometimes go on to Delta Dental or Blue Cross Blue Shield or one of those other plans on a standalone plan. I don't want you to panic. We can help you. And that's what we do.
And Lori, before you pass the mic to Dr. Quick, I just want to drill down a little bit farther in that. So all of that, as you were listing off all those things, it sounded great, but to me, I heard a little cash register sound going off in my mind thinking, oh, but I'm going to be paying for each one of those things. Can you speak to the difference once a person is hospitalized, say hospitalized for more than 3 days, of what the Medicare coverage is versus Medicare Advantage?
When, if you have Medicare and a Medicare supplement, Medicare supplements pay the deductible, which is about $1,600 to be in the hospital, to be an inpatient, which is 3 days inpatient. Your supplemental plan would pay that. You wouldn't have a copay. Many of you would have Plan F, maybe high deductible. You wouldn't pay anything out of pocket other than your premium every month. And some people say, well, yeah, but that's a premium. Paying $200 a month for 12 months is $2,400, right? When you're in a Medicare Advantage plan, typically your out-of-pocket is anywhere between $3,000 and $8,000. So you don't have this wonder of how much this is going to cost. And you don't have the additional middleman Medicare Advantage plan making decisions for you. Your doctor says you need this MRI, you can get it. With a Medicare Advantage plan, they make you jump through hoops. And I'm going to say this, in Kansas, in the state of Kansas, there are hospitals going out of business because of Medicare Advantage plans not paying them enough. So LMH is doing the right thing. They have to, so that they'll be open for us in the future.
Thank you so much, Lori. And speaking of doctors, I'd like to ask Dr. Quick, thank you so much for being here this evening. And I know that you're in private practice, which means you don't have Mary necessarily and her team making those calls for you. You have to make the calls to challenge anything that comes up that might not be to the benefit of a patient. So, and if you can, tell us about how the insurance coverage for your patient 65 and over, because we could go on about insurance in general, I'm sure. But for those patients, how does that impact your practice? And what are some of the things you've seen?
Well, I'd like to start by saying, this is a little, something for you to remember as I go on. Delay care, deny care, defend payment. That is that's my mantra every day. Okay, that is what I live by to try and take care of patients here in the hospital. As Mimi said, I'm in private practice, but I contract with the hospital and I am the medical director of the 4th floor, which is our rehab and skilled nursing unit. So that's where I'm primarily working to get patients. So the delays in care, I will get a referral on a patient to bring them to rehab. I will go down and see the patient and they've had a stroke. They need rehab. There's no doubt about it. And I say, yes, absolutely. Let's get this patient up. Oh, they have a Medicare Advantage plan. So I have to start the authorization with the insurance company. And we start the authorization and we wait. And we wait because now we go into the second part of my day, which is delay of care. We wait and we wait and we wait. And sometimes we wait up to 10 days to get an answer if that patient is going to be allowed to come to the rehab unit. Typically, it's 3 or 4 days, business days. So add in a weekend where the patient waits and sits down on the floor and waits. And nobody's getting good care. I mean, they're getting great hospital care, but not the care that they need at the time. They need to be on a rehab unit getting intensive rehab so that they can rehab from their stroke and get back home. So while we wait, then they deny. Okay, so now I've got a denial, which I knew was going to come because it's a Medicare Advantage plan. So they offer me what's called a peer-to-peer. What's a peer-to-peer? It sounds like it should be a physician that's in my area of specialty that I talk to and make a case to bring this patient to the rehab unit. No, I get to defend my case sometimes to an obstetrician. I would not.
Probably not needed by any of your patients 65.
No, not typically. I would never attempt to tell an obstetrician what is appropriate care for his or her patients, but that's what I'm being told. They don't need this level of rehab. They can go to a nursing home and get it. All the studies show that people who go to acute rehab that can tolerate the intensity of it are going to get home faster and have a better outcome overall. So I can quote all the studies, but it doesn't matter. So I may actually get to bring that patient to rehab. But when I'm told I get to bring that patient, I'm told authorization of care does not guarantee payment. Again, what do I do with that? Well, I bring the patient and I hope that the hospital and I get paid so that I can keep doing this every day. So then I may be denied though. So the peer-to-peer is denied. The patient either then has to go to that nursing home level of care for rehab, or the family can appeal it. Now, oftentimes that appeal will take up to a couple of weeks. And so either the patient most normally just goes to the nursing home and just doesn't appeal it because it's not worth it at that point to them if they don't think it's worth the fight. Or they'll go to the nursing home while they appeal that decision, and then we may get an approval and we bring them back to start the rehab process. But usually the patients end up at that nursing home level of care, are there longer than they need to. And while our nursing homes and our skilled facilities provide great care, we have a skilled facility on 4th floor. We do a great job, but there are certain types of patients that don't need to be there. They need to be on acute rehab. So then it goes to the next part of my day, which is defend the payment. So on the back end, when I get calls from my office manager saying, well, they decided that you didn't do enough work to get paid this amount, they're going to downgrade you to this. But if we just change some wording, they'll go ahead and pay you at that higher level. Well, I'm going to put in my chart what I did, and I meet the criteria to bill a certain amount. That's what we expect to get. We expect to get paid for the work we do. I'm not going to fabricate work. I'm not asking them to pay me more than what I need to be paid. And it's the same thing for the hospital. We often are having to defend these cases months and sometimes years down the road while they withhold payment for us. So how do you continue in a business where you have no guarantee of payment, or you never know how much you're actually going to be paid? And sometimes they pay you and then they realize that, oh, maybe we shouldn't have paid them that. And they'll go pull it from another patient, from another payment that they're coming. So we'll get a payment for X amount of money, but they've deducted this because they thought actually it should be down coded. So this is what we deal with on a daily basis. And all of it comes around to affecting patient care. It affects patient care. I just want to walk in the room to traditional Medicare patients, say you need rehab, let's get you up there tomorrow. We get you up, we get you going, we get you home.
Thank you so much, and thank you for all you do for our community, Dr. Quick. We appreciate you and your colleagues. So I want to open it up for questions, and here's how this is going to work. Since we're recording this for everybody to see later, I'm going to try very hard to hear your question, and then I'm going to repeat it into the microphone, not only so that everyone can hear it, but so that everybody who's getting the recording of this can hear it as well. So who would like to get us started tonight? Yes, sir.
Yeah, I'd like to ask Dr. Quick, what you just said, does that apply to all Advantage or is a PPO treated differently?
So the question is, does the story that Dr. Quick just told about the day in the life of Dr. Quick, does that apply to only Medicare Advantage or is PPO different?
Is PPO better?
Is
Medicare.
PPO,
Traditional Medicare?
It's
PPO.
still Medicare Advantage.
Oh, yes, then, yes, it applies to all Medicare Advantage plans. But I will say that in terms of denials of care, I see it much more with Aetna, Humana, and United.
So I've got Aetna PPO, so I'm that faster.
Mary Lawson, do you have anything you want to add to that question?
Is that a retiree plan?
Correct.
Yeah, that it's gonna be the same thing, and it would depend on if you had out of network benefits, but. You know, you still have the same issues.
Yes, ma'am.
What about a PPO, ESA?
Okay, the question is, what about a PPO ESA? Lori or Mary?
It's the same thing. It's an Advantage plan, and you still have to get those authorizations. They're still gonna be treated the same way.
Yes, ma'am.
My mother is on Aetna Smart Bid, and I got a letter from them saying they're discontinuing the plan completely next year, not even gonna be available. And they said because of that, she would be eligible to get a Medigap plan. And I'm thinking I need to move her back to original Medicare, but I question, and she was also, she's on hospice.
Oh, I'm sorry to hear that. And if I understood correctly, tell me again the name of the plan that's being discontinued. And a Smart Bit or Fit? Fit Advantage plan being discontinued, and you're wondering, should she go back to traditional Medicare?
Not only that, but I got a letter saying that because they're discontinuing the plan.
She can go back without wanting.
Medigap, go Lori, go.
That is true. She has a guaranteed issue right. Within 63 days of that plan ending of getting a Medigap, or in Kansas, they're called supplemental plans. I don't know why, but they are. And now if she's on hospice, well, no, hospice helps. If she's on hospice, that will still, we can talk about it. I'd say make an appointment at the Senior Resource Center. We can help you look at supplements. She would need a drug plan as well. But if she's on Medicaid, for anyone that's on Medicaid, okay, and okay. So yeah, we could look at a Medigap plan, and it would be good to do so because she might not stay in hospice.
Right. As long as she's in hospice, it's my understanding she's on traditional Medicare.
Yes, that is correct.
Correct, but if she goes off hospice, and that plan's not going to be available, she'll go back to original Medicare anyway, but it would be good for her to have a supplement. Does that make sense?
Can I make one point here? And it's a great example. One of the other things in this consideration, realize that Medicare Advantage is relatively new, right? It's probably the last 10 years. And one of the things also that's a risk here is not a provider hospital deciding we are not going to contract, but the insurance company itself deciding this plan doesn't work for us, therefore we are simply going to cancel it. And I talked to a lot of my colleagues in the Kansas City area which has the same more plethora of plans, and they have more displacement of Medicare Advantage, not from provider hospitals saying we are contracting, but simply from the insurance company saying, we are no longer going to support this plan and you've got to, select another one. So that's the other disruption
If I
of this.
Yeah, I was gonna say, if I can piggyback on that, so if Medicare Advantage, if you have a Medicare Advantage plan that is leaving the area, that means that you can go back, if you want to, you can go back to original Medicare and the supplement, without going through underwriting. And so that's what any Medicare Advantage plan, the actual insurance carrier has to be leaving that area. Not like, for example, the hospital saying that you no longer can get that, or have that, or accept that in Humana, but if the actual company is leaving, that means you can go back without underwriting and get a Medicare supplement plan.
So I'm gonna just hold on, Pat, because one of the questions from our overflow room was similar to that. She's had Medicare Advantage for many years and wondering, is there a penalty payment for going back to traditional Medicare?
No.
No, it's not,
There
but you
is
have to go
not.
through underwriting.
Okay, and sir, I know you've been waiting for me, so go ahead.
Right, if we've had a good experience with our Medicare Advantage plan, are there surrounding hospitals or that are still going to accept Humana and Aetna?
Sure, Lori, it looks like you can answer that one. Probably, but they wouldn't be here. Your doctor who's affiliated with LMH won't be taking it. Your hospital care won't be at LMH. If there's an emergency, a true emergency, life and death emergency, you'd probably be taken here and then transferred to a different hospital. And then you'd probably be liable for the ambulance bill. But, it's a risk you're taking. And, a lot of times people feel some kind of loyalty to their insurance plan. They're paid. They are paid. And they're using your money, So I'm pretty sure that even if you like your plan, we could probably find a plan that you would like just as much. Okay, thank you. And I'll take another question from this room and then I have one. Yes, sir, ma'am, sorry.
Hi, my name is Cheryl and I work in Kansas City at an acute rehabilitation hospital.
Okay,
Everything that they are saying is the truth.
thank you. So Cheryl from
Yeah.
Kansas City backing up our
To
panel.
be honest with you, I was Lawrence Memorial and I was mad. I started digging into it and they're 100% true.
Well,
My
thank you
parents
for
and
that.
residents forever here. And I want to know how can we switch them back from Aetna, Humana, or whichever one they are, the Advantage back to traditional medicine.
Right, well, it
How do we
sounds
do that?
like you can visit with Lori or you can call Mary and she can help you find a way.
They are telling you the truth.
Yes, thank
Okay.
you for that.
Ridiculous.
I'd like to ask a very basic question, I think.
Sure.
How do I know for sure whether I've got a Medicare supplement plan or a Medicare Advantage plan?
So that's a great question and similar to one that we also had from the overflow room. The question is, how can you tell if you have a Medicare Advantage plan or a Medicare supplement plan? Lori? Well, if you have your card, I'll take a look at it and tell you. Okay, perfect. So, and here's another question. Talk about IRMA based on taxes. Does one of you know how to interpret that? Pat?
So that's IRMA, it's adjusted, income related monthly, yeah, but basically, it's, the government penalizing you for doing well, income wise. So there's gonna be a bracket that's gonna show how much you can make as far as individual, make as a couple. And based off that, there's gonna be a surcharge on your Part B and Part D, premium. There is a way to get away from that or, I'm blanking on the word. There's a form that you have to actually fill out. If that is the case and you're paying a lot more for your Part B premium and your Part D premium, you can fill out a form that allows you to appeal that and get that back down.
Can I say something?
Yes. IRMAs, which, most of us don't have to worry about, income related monthly adjustment amounts. They aren't penalties. Basically, the government subsidizes each of you, gives Medicare $1,100 a month, roughly $1,100 a month to cover you, okay? When you are doing well and making more money, which most of us don't have to worry about, then they just subsidize you less, okay? So it's not a penalty. Also, that $1,100 a month that the federal government gives Medicare, when you're in a Medicare Advantage plan, they give that to the Medicare Advantage plan instead. And that's why they want to hold on to it. Right? Hence the triple D. So I wanted to just, before we go on to other questions, because two more of the questions were again, will there be a penalty if I switch back to traditional Medicare? And I hope everybody in the other room can see. I'm sorry, I just blocked the camera with my glasses. That wasn't very helpful. I apologize for that when you all rewatch this at home. So the fact is, go ahead and say it again, Lori. Well, let me tell you, there won't be a penalty, but some people think that there's a penalty because it is hard to get a Medicare supplement or Medigap plan when you are older. The time to get into a Medigap plan is usually the first 6 months you have Medicare. So sometimes it is harder because they do medical underwriting. But you can always have original Medicare again without any kind of penalty. And there are options with supplemental plans, like high deductible supplemental plans, that are kind of a safety net. Good. So less fear there than I think. I know there are so many concerns and so much anxiety, but that's one less thing to worry about. Yes, ma'am.
Wonder if there are 4,000 of us, and we have until January 1st, really.
Yes.
December 7th.
I'm gonna go see somebody.
Yeah.
Soon.
Yes, you're a doctor, you mean? You're going to see, or a consultant? Okay,
Yeah.
okay.
But my guess is that tonight that phone will ring off.
It has been. We've taken, I think now we're up to 600 calls. I saw 650 calls.
I made calls here and to senior center, and it was wait until this thing happened.
Okay, well,
So now I wonder if I can get an appointment.
so the question is, how will we take care of 4,000 people needing help? And between the senior center and LMH, we hope that, we certainly hope that this event tonight clears up some of that, so you at least know where to go for more assistance. And if we find, Rob, if we find that there's a need for another event like this, we'll absolutely have one. If we find that there's a need to host a senior center event here as well as at the senior center, maybe we can work something like that out. We aren't going to let you struggle through this alone. So another question. Yes, sir.
Wow, all Medicare Advantage plans.
Rob, do you want to take that one? The question is, do we plan to allow or to disallow, in other words, do we plan to cancel all the Medicare Advantage plans?
No, right now in our market, we have 4 insurance companies providing. We have Aetna, Humana, United Healthcare, and Blue Cross Blue Shield of Kansas. We are continue to contract with United Healthcare and Blue Cross Blue Shield of Kansas, which is a pretty small plan right now, I mean, as far as enrollees in this market, but those two. And, you know, I do want to say one thing that's really important in this whole discussion. One, we'll dedicate the resources to do whatever we need to do to make it happen. And, you know, that's easy for me to say, but I have a great senior director as well as many in our revenue cycle. We'll put whatever resources we need to put to make this happen. Secondly, I hope in this discussion you understand, if I will say this, and obviously I was part of the decision, if this was just about managing denials, we would not do this.
No.
This is about patient care. This is about the inability to get the care to our citizens that we need to get. And, you know, Dr. Quick has obviously a number of stories, and it permeates our medical staff, which is to say, they feel bad when they're trying to work through these things, and they know that, because one of the things I've learned, not being a clinician, is time is everything. If you have a hospitalization event, whatever it is, getting you to the right care and the right time is absolutely critical for your recovery. And we simply can't do that with these plans. So no, we're not. United Healthcare will remain, as well as the Blue Cross, and I can't even remember what they labeled it, but Blue Cross. And that's why we'll have, our counselors there, but we'll put the resources there to make it happen.
Thanks, Ron. Next question. Yes, ma'am.
Why are you keeping Blue Cross Blue Shield of
Oh, that's a great question.
It really is based on our, although not great, better with denials and working through them. And I would say it, it's not like this and this, but I think we also recognize there are some hospital systems in the country that have kicked out all Medicare Advantage.
Yes.
We felt like that was not the right choice for our community. And also we do have a fairly sizable population of with United Healthcare as far as commercially underwritten, like employer plans too. So we have a little bit more ability to be able to negotiate and to work, because understand, it's not like the insurance company, we don't talk to them, they don't talk to us. We're having conversations with them all the time, and that was kind of the subjective. We just felt like these were two plans that we just felt like we couldn't make much progress with as far as figuring out the denials and all that.
I'm going to say this one more time. I'm going to stand closer to this microphone. I'm so sorry, overflow room visitors. I hope this is better for you. This is another question asking the same thing. Give an example of why Medicare might deny someone to switch back from MA plans to Medicare. And the fact is,
There is no reason.
there is no reason, because it does not happen. Yes, ma'am.
So my understanding is I have a Medicare Advantage, so does my husband. He has an autoimmune disease. We've had no issues so far, but I live in Kansas City, so he's going to KU. But how long, my understanding is if I switch him, they're gonna underwrite him. How long, can you be on that plan, is my understanding, for a year?
So
Or
you're,
they underwrite?
so can you be on Medicare for a year before they underwrite you if you switch back from a Medicare Advantage plan is the question. Lori, do you need to
I
ask
haven't heard of that rule.
My understanding when I made my phone calls was that so for us, it will be 18 months this year.
That you both been on Medicare?
So, yeah, that we've both been on Medicare Advantage.
Okay.
So far, everything he's needed's been covered. But if I want to switch him, because I'm fearful for the future, my understanding was if he was on it for 1 year, they would not underwrite him. You have 1 year to Medicare Advantage.
No,
If
I
he's on
understand.
Medicare Advantage for a year,
Yes,
they won't underwrite him.
no, they will underwrite him, which means, okay,
My
Medicare won't.
understanding, we have
Over
1
a
year
year.
to
Okay,
try it.
the terminology is a little different, okay, so Medicare won't. Okay,
Right.
Medicare won't, but a Medicare supplement, if you have been on a Medicare Advantage plan for a year or more, then you,
Medigap.
for a Medigap, that is medical underwriting. And that can lead to denial of having a Medigap plan, or maybe paying more, or you could get a plan that is a high deductible plan, which means Medicare would pay 80%, and then the 20% that Medicare doesn't pay, you would cover up until $2,800, and then everything would be paid for. So those are options for people. Mhm.
Okay.
Yeah, so those are options. There are a lot of different options. I know, especially with an autoimmune disease, it's scary and, but I'd say never when it comes to getting a Medigap plan. Okay, we can help.
Thank you, Lori. Yes, sir.
I just mentioned, I think there's things that is important about Advantage plans that have not been discussed.
Yes, something important on Medicare Advantage plans that has not yet been discussed.
And they literally change every year, sometimes more than once during the year.
That they change literally every year, sometimes more than once in a year, and give an example of what you
Let me give
mean.
you an example. I have United, which I've been pretty happy with, sorry.
No?
That's fine. We're so glad you're happy.
Yeah.
I went to my dentist as a part of the dental program. I had a filling done. And I got a note back saying that they had denied the anesthesia for the filling.
Well, you don't need an anesthesia for a filling.
So I called them up. And they said, well, we've changed. We don't permit the local anesthetic, or we don't permit that anesthetic to be used anymore. I said, well, it was a lidocaine, it's a local anesthetic. What would be acceptable? And you hear the papers rustling, because as you know, Dr. Quick, it's some high school kid, I think, looking at it. Or an OBGYN, I don't know. You know, reviewing the data. And now I'm gonna be in all kinds of trouble with my OBGYN friends. But the point being that he said, well, we would approve nitrous oxide or propofol.
So what you're saying is that it might be
And I said,
not,
I'm sorry, I'm a pharmacist. You're not gonna fill a cavity with me getting nitrous oxide or propofol. It isn't gonna happen. And by the way, if there's a dentist in town that does that, you're probably not gonna wanna go to them. So
so your coverage remained the same. It was the drug that, or
here's my
the,
point, there's my example.
uh-huh.
You know, I had previous work done, had no problems. This year, a little bit of work done, all of a sudden, stuff's not covered.
So I hope that that came across from the mic, because that was a great story in so many ways. But just the fact that there are so many different nuances to what they can change their mind about that impacts healthcare. And having to bite a bullet, I guess you can't bite a bullet while you're getting a tooth filled.
Phoebe?
At all. Yes,
Amy, can I add something?
yes.
Pat, you're talking about being reviewed by a peer. Keep in mind also that AI is reviewing things as it goes through. People aren't even looking at this. Sometimes it's just artificial intelligence that's reviewing these initial things that are coming through and deny it because nothing's really being read by a human being.
Yes, Lori.
I just want to say one more thing. I don't want people to think that the Senior Resource Center doesn't help people get into other Medicare Advantage plans, because there are other Medicare Advantage plans. Like you said, Blue Cross and Blue Shield and United Healthcare, there are probably 4 to 5 plans each under that umbrella of Blue Cross and Blue Shield, Medicare Advantage, and United Healthcare. So don't feel like you should only come to us to get out of a Medicare Advantage plan and back into original Medicare. We can help with other Medicare Advantage plans, because some people, they work best for some people.
I want to ask one question. I think it's important for full disclosure, okay, on traditional Medicare. On traditional Medicare, without a supplement, there is no yearly out-of-pocket maximum.
Correct. There's
Right.
no safety net.
That is an important thing to understand, is that, again, that's just for full disclosure, an important thing for people to
Just
understand.
repeat it one more time at the mic, a little closer.
Why don't you, I'll defer to the expert.
What he said was, and this is a good reminder, and I should have clarified it, that if you have original Medicare with no supplement, no Medigap plan, there is no out-of-pocket max. Which means if you have a bad year, you could have a really bad year, okay? You're responsible for 20%, roughly 20%, without a Medigap plan. So there are different ways to look at this, but the main thing is don't panic. Let's just look at the options.
Right, and I think back to Pat, what you said, Sometimes it's just the list it out and compare everything side by side. And because something that works for one of you isn't gonna work for another. I'm so glad you said that about other Medicare Advantage plans, because it might just be perfect for you. Yes, sir.
What is your phone number and what time can we get?
Okay, we'll put that, we'll add that too, when we send everything out via email. But go ahead and tell them. I did leave some material out on the table, some cards. But our Medicare helpline at the Senior Resource Center is 785-727-7872. Now I'm gonna tell you, normally this time of year, we have 1,000 people come through to do this on a normal, year. We're going to be working as hard as we can to see as many people as we can. But one thing that you might not realize is that you can always, during this time between open enrollment, October 15th through December 7th, you can also call 1-800-MEDICARE and they can help you enroll. You just gotta say, no Humana and no Aetna. And there are great people like Pat and other folks in the community who are brokers who are not looking out for themselves first, who will help you. So I'm sorry, let me down here. You've been waiting and waiting for me.
No, not really. I just want to say that we've been on an Advantage plan for like 3 years, 2 years, 3 years. And just randomly in the beginning of 2024, several of my doctors, I got letters saying that they were no longer accepting my insurance. But when I agreed to do the Advantage plan, they were in network. But then I found out, they can pull out whenever they want.
Yeah.
So people need to know that, and we did not, so.
I'm so sorry to hear that. Yes, ma'am.
What are your hours?
What are the hours at the senior center? I'm afraid they're gonna be 24 hours a day. We are open, for appointments, we usually see people about from 9 to 4. We're open 8:30 to 4:30, Monday through Friday. Now, I'll tell you, that phone number is the Medicare helpline. You're gonna leave your name and your phone number, your contact information, but it's gonna take us a few days to get back to you. Do not call multiple times. Just don't. Yes, ma'am.
Please give that number again.
Yeah.
That number is 785-727-7872. And I think I'm in charge of the senior health insurance counselors for Kansas. I have volunteer counselors, a couple of them are here. I'm not gonna point them out because but we do our best and we do a good job, and they're retired professionals mostly. But we're gonna do what we can. There's gonna be we probably won't be able to see everyone, but we're gonna do what we can. And we'll do what we can to help as well. Yes, ma'am.
Aetna WellCare,
Aetna WellCare.
is that a medical advantage?
No,
Yeah.
is that a Medicare? Those are two different things. Aetna is a Medicare Advantage plan, and WellCare, All Care is a Medicare Advantage plan. So there are three, I believe, from what I've read, Lawrence Memorial is gonna be taking All
Right.
Care next year
Mary
too.
can answer that.
Yeah,
one.
sorry.
We do take the all care. The all care will stay.
Which is WellCare, All Care,
Yeah, I believe that is a sunflower plan, actually,
Yeah,
and not an
it
Aetna
is. It's
plan.
not.
Okay. Yes, ma'am?
No, there's a.
Right. One of the things about the Advantage plans is they offer dental, hearing, and vision. So,
Right.
right. Well, let's let Pat speak to that. How did, yes,
A reputable broker, I would say definitely just kind of, word of mouth, if you know someone that's also on a plan and maybe they've had a good experience with a broker, I would say that's a good way, just asking around, maybe, searching on.
sure.
Yeah.
Right, well, I think that, you can also look for who's, for example, maybe start with who's a member of the Chamber of Commerce, who
Yeah.
cares about their community enough to join the chamber, that's a good idea.
And the senior center advise on those.
Yes, we do, but we ask, okay, before your appointments to look at Medicare Advantage plans, we want, if you already have a dentist, we want you to ask your dentist which insurances they take. We want you to ask your doctors which insurances they take. We want you to ask your specialists if they're not in town, which insurances do you take? Because we're gonna be getting people through as fast as we can, and we can't dither, okay? You'll need to bring your Medicare cards, your actual Medicare cards, okay? Not, you can bring your Humana cards or whatever, but we need your Medicare card and your list of prescriptions with the name of the drug, the milligram, and the frequency.
And so that was, I'm sorry, I failed to repeat the question for the folks in the other room. That was, if you have a Medicare Advantage plan, or you know that Medicare Advantage can cover things like dental and maybe a higher degree of pharmaceuticals and vision, then how do you compare what Medicare supplemental insurance might cover in regard to that? So that's what Lori was,
Oh, that's not what I thought the question was.
oh, but I was misstated.
How to go about finding them.
How to go about finding them. Yes, I'm sorry. How to go about finding that. And I think it's very important. Do you have some of that information online about what people need to bring before a visit? Because that's important to take no matter what, and it may be in your guide.
Well, let me tell you,
Yeah.
we have it,
don't think
if
that
you
is.
go ahead and, you can go online to make an appointment too. You don't have to call. It's, yoursrc.org, and you can make an appointment that way. And you'll get a reminder telling you, bring your Medicare card, bring your drug list. If you come and you don't have your Medicare card, there's not much we can do.
Pat, you were gonna say something?
Yeah, it was, you mentioned that you just moved to Orange. You can actually switch and go to a Medicare supplement, or Medicare, original Medicare supplement without underwriting. Oh, okay. Congrats.
Okay, and you got it. Yes, okay. Yes, sir.
Would there be any benefit in, since it's such a large group of people here, writing to the insurance company and saying, hey, I'm thinking about leaving your Advantage plan because I don't feel like I can get, number one, my hospital dropping.
So, yeah, the question is there an advantage to, oh, yeah, good point. Would there be any point to, just a second, let Shannon answer.
Well,
It just, let me restate the question.
You're probably gonna say
You
the
guys
same
are so hard to control. I hope I can remember it. So the question is, would there be any help in reaching out to the insurance company and saying, hey, I'm thinking about discontinuing your plan? Well, but it was his question. I'm just restating it. Did I have your question
Yeah.
right? Okay. Yeah, blah, 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 blah. Thank you. That was the most profound part. Go ahead.
So actually, the answer is yes. And I say that because at KHA, we're constantly trying to tell CMS, Medicare, the federal government, what's happening with these plans, these patients that are being harmed. We're finally making some progress to where they are having to have certain regulations or stuff. The more they hear from patients, the more the federal government has to do something. So I would prefer writing a letter telling them.
what about writing a letter to
To our senator.
Senator Moran, Senator Marshall?
yeah.
Yes,
That would help. They actually do want to hear those things.
yeah.
Okay, and I want to also say that we did have, Tracy Mann came and had a great visit with Russ Johnson, our CEO, and Rob and Dr. Quick, all about this issue, and he took copious notes and was alarmed to hear Dr. Quick's stories in particular about how it impacted Kansas. So there is hope there. Next question. Yes, ma'am?
Medicare and Medicaid. I'm not familiar with Medicaid. How does that figure?
So the question is, she has a friend who has Medicare and original Medicare and Medicaid. You're not familiar with Medicaid, so how does that figure in? Medicaid is a completely different plan that is based, well, I don't know why I'm talking because I'm not an expert.
Yeah, your Medicaid is gonna be based on, basically your, income, basically.
Or
and what-
disability.
A disability. So you would have to, we do have people here at the hospital that can probably guide you through that. But yes, you do have to apply for it and meet certain.
Yeah, you have to meet certain criteria.
Thank you.
If you have both Medicaid and Medicare, you can have what's called a dual eligible.
Yeah, yes.
Medicare Advantage plan, so there are some other options with regards to that.
Medicaid also has some HMO plans like.
And Medicaid has some HMO plans available.
But in Kansas, it's really hard to qualify for Medicaid because
We don't have expansion.
We don't have expansion, and that's what you need to write about. Yeah, right, Shannon?
Yeah.
We need Medicaid expansion
Yeah.
in
every other state,
Kansas.
every other state is taking it and we're just turning our nose at free money.
Next question. Yes.
Question, about pre-existing conditions, yeah, because I'm due for a $10,000 shot in, February.
I hope they don't offer to change it out for nitrous oxide.
Getting a little morbid here, isn't it?
So are pre-existing conditions, so to your question is, are pre-existing conditions covered?
Yes, yes.
So in February, you would still be able to get that $10,000 shot?
With a different Medicare Advantage plan. Possibly, I guess, and original Medicare, yes. Now, if you are applying for a supplemental to go with the Medicare, you might not be able to have that covered. But Medicare would cover its portion, okay? There's no pre-existing conditions with Medicare.
We have a question over here.
If you have someone who's on disability, not retirement age, and they have at least once been denied for supplemental insurance. So your only option is to risk exorbitant out of pocket. Or go with what, one of the few Advantage plans you still carry.
Are they eligible for, would they be eligible for Medicaid? No?
Not Medicaid.
Okay.
So short, live again.
She wasn't able to get Medicaid.
And they've applied for Medicaid? Have they applied for that? Okay.
Well, it takes, we may need to look at that one individually to try and help you. Okay, well, go ahead.
At 65, you get a second enrollment
Yeah.
period. At that point, you do that.
At 65, you would get your second initial enrollment period. At
Yeah,
that point, you could reapply. for this.
That's a 10-year wait. I hope someone can find the answer for you. Yes, ma'am.
How about mental health coverage?
Between Medicare Advantage and Medicare, is there a difference in mental health coverage?
It just, the difference is which providers accept Medicare and or the Medicare Advantage plan. Those are the differences.
So when you consider making the change, make sure that you check to see who your provider is and if that provider is part of the plan that you're considering. Is that an accurate answer, Lori? Okay, I'm almost becoming an expert. Not at all, sorry, Mary, but my real name is Mary.
You don't go by it though, why is it?
No. Yes, sir.
So a couple of years ago, I changed from a Blue Cross Blue Shield Medigap plan Because LMH and Blue Cross and Blue Shield got differences. They were trying to encourage me to go to, they were going to incentivize me to not use this hospital, but to go to Topeka. Are those problems solved?
That would be, if it was a Blue Cross and Blue Shield plan that did that, that would be Blue Cross Blue Shield Select. That is a specific type of plan that only allows you to go to certain hospitals. Normal supplemental plans follow you wherever you go with Medicare.
It's not true.
But, yeah,
I had
this is-
Medigap G.
This is a
And I
different
could come here,
question.
but they were incentivizing me to go to Topeka. They did not.
They were
Yeah.
incentivizing you to take their Medicare Select plan, I bet.
Wait, no.
That's what lots of them did.
This is a question
I
he
think,
needs.
I think,
Yeah.
I understand the question. So I negotiate with Blue Cross, right?
Uh,
I was not CFO at that time, but there was quite a, let's say, misunderstanding between LMH and Blue Cross of Kansas, which eventually got resolved. It got in the paper, you know, we made some signals, we may be out of network. That is not the case now. I will say our contract with Blue Cross is up at the end of the year, but we are on the glide path to getting a deal done. It always takes time, but we really see them as a partner in this community. And our own health plan is with Blue Cross of Kansas. So I think what we recognize is that they are a very large commercial payer in the state of Kansas. We need to figure out how we get along for, you know, we have our economic interests are juxtaposed to each other, but still, I think we all have the best interests in mind. So I think that we will not have that going forward.
There's a big difference between normal insurance, normal Blue Cross and Blue Shield insurance, like I might have, or like you guys have, and supplemental insurance. The place you go doesn't have to accept the supplemental insurance. Medicare is the one that tells the supplemental insurance to pay the 20%. So you can go anywhere in the country that takes Medicare with those plans. I think it was just a bad misunderstanding with Blue Cross.
So let's take one more question. And then anybody else who has a question, come down, I'll write them down and we'll get an answer for you. Because it's now 10:50, so we've kept you all here a long time, especially those of you who got here early. Yes, sir.
I've got a CFO question.
Okay.
regarding-
He has a CFO question.
Regarding Blue Cross Blue Shield.
Sure.
Okay,
It's my understanding that they have 4 different Advantage plans.
Blue Cross Blue Shield has 4 different.
They have one Advantage plan that for my wife and I, we would pay an additional $40 a month each, which appears to be the pinnacle of their plans. Are you at liberty to say, is that worth paying that extra?
Oh.
We are not. Let me give.
On the record.
Yeah, as a representative of the hospital, we give no advice, okay? So what we do is provide those plans, we contract with them, and that's why we allow them to make those selections. So I think that probably a lot of those plans just depends on your personal situation, the kinds of things that you may have to address as far as health issues. To me, what they're trying to do is kind of fit that to your personal situation, but we would not give any counsel on that.
all right. Well, I want to thank our panel so much for all the support tonight. And if you want to come up and visit with them, feel free. And if you want to come up and visit with me, I will take your questions. Thank you.